Hi, everyone, and welcome to Module 1 of Dissemination Essentials. You are the second webinar that we are doing this week. We just did one yesterday with the first group of people from the other side of the world. So I'd like to warmly welcome all of you today. We're very pleased to have you here. By now, you should know that I am Stephanie, and I am your host for the course. And the topic for May is considering and involving your target audience. And your trainers will be Jess Hendon and Shauna Hurley. So Shauna won't be with us live today since she is in a time zone that unfortunately doesn't match up with us, but you will hear from her through a recorded video. And it's so great to see so many of you with your cameras on. It's wonderful to see your faces when we all can't be in the same room. I will likely turn my camera off when I'm not presenting, but feel free to do what you wish. And yeah. All right, can I have the next slide, please? Awesome. So you've heard of dissemination essentials, and now we are going to talk about some Zoom essentials for participating today. So unfortunately, because there's so many of us, it's tricky for us to have a spoken dialogue during these webinars. So I'd ask you to keep yourself muted if you aren't speaking. It's never fun to hear someone else's background noise. So I'd like to check for you all to check right now just to see that you're muted, and that would be great. And throughout the webinar, we do encourage you to interact with us and with each other through the chat function. It's probably the best thing we have with this many people to be able to speak to one another. So you can see on the screen how to use that. Jess and I will be monitoring the chat, so any questions we can't answer during this webinar will be answered at the Ask the Trainer session in 2 weeks' time or on the Learning platform. Next slide, please. So we have a packed schedule of learning for you over the next hour, and we do have that dedicated Ask the Trainer session in 2 weeks. So we'll limit the number of questions we take off mute. But in case you have a burning question or concern you'd like to say out loud, you can let us know by raising your hand, as shown in this photo, and we will get to you. Next slide, please. All right, so at the end of April, there was some pre-course materials and activities on the Learning Experiences platform. And thanks to everyone who has logged in and interacted with the content so far. It's been great to know you and hear your thoughts. And especially to those of you who have recorded a Flipgrid video. At the beginning, I think a lot of people might have been nervous, but we have a number of videos up now. So it's great to see you all and to get to know you that way. So feel free to check them out, comment, like each other's videos. It's our way of networking when we can't all be together. So we also asked you what your hopes and what your fears are for the course. And I'm just going to summarize here what I've heard from you on the platform. So in terms of your hopes, you're excited to be in the course. Great, excellent. We're excited to have you. You want to meet new people and you want to expand your networks. So don't be shy with replying to people's messages on the platform, interacting there. Again, on Virtual Face Wall, feel free to reach out to one another. We hope that you can build those connections through those online ways as well. You want to learn new and practical skills. So we've designed this course to be appropriate for people at all levels of dissemination. So whether you're just starting out or you feel more advanced, there should be something for everyone in this course. You also want to make your dissemination more effective. Well, that's great because I think you're going to find the trainers that we have for this course very helpful in that regard. Now, in terms of your fears, what we've heard most often from most of you is that you're nervous to fit this course in with your current workload. Many of you work part-time, you have a lot of other responsibilities. So to address that, we hope we've designed what you learn due to having a lack of time or resources. So what we're trying to do in each module is share with you some basic fundamentals that you can apply with limited time and resources. Because in many ways, better dissemination is just reframing how you think about something. It doesn't necessarily mean you have to do something more fancy or time consuming. We've also heard that you are worried that the course material might be too general to apply to your situation, which is fair because you're from all over the world. You have varying levels of resources and topic areas and situations that are unique to you. So we're going to try to include a lot of unique examples from around Cochrane in this program, but you can also feel free to reach out to your trainers, reach out to us through the Learning Experience platform with any questions you might have about what you're doing specifically, or anything that applies to your unique situation. And we'll do our best to provide tailored advice or feedback. And lastly, at one point, it seemed that you were nervous to do a virtual face wall, although now with over 50 recordings, maybe we have gotten over that fear. So that's great to see. And if you're really too nervous to do one, then just go on and comment on other people so that we can start to build a community amongst ourselves. So I'm going to stop talking right now because I'm not the one who's going to teach you about how to do dissemination better. That's Jess and Shauna. So I'm going to pass it over to them. And I'll talk to you again at the end of the webinar with some next steps and what happens after this. So over to you, Jess.
Okay, great. Well, hopefully everybody can hear me okay. And I have to say, my biggest fear is that I'm in control of the slides. And I fear that I may have already done some graffiti on some of the slides and not realized that I've done that. So I'm really sorry about those yellow scribbles. And I'm also really worried that my children might decide to join me in this one because they've just arrived home from school. Okay, so unfortunately, you've just got me for most of it today because Shauna couldn't join us because of the time zone, but she has recorded some video footage of herself. So you will get to hear from Shauna in a little while, and you'll just have to put up with me speaking to some of her slides. And I'm sure you'll be able to tell which ones those are because there's lots of great examples from Cochrane, Australia, where Shauna is based. So yeah, so hopefully some of you do already know me and you might have seen me on the Flipgrid, but I'm Jess Hendon and I'm the managing editor of Cochrane Common Mental Disorders. And hopefully my first slide's going to come up. Great. So I'm just going to start off by telling you a little bit about what we're going to cover in today's webinar. So when Shauna and I got together to start planning the webinar and the homework material, we tried to think about how we'd break this session down because there's actually so much that we could cover in just a short space of time. So we've broken today's session into kind of three sessions within one. So the first thing we're going to do is think about target audiences. Then we're going to cover dissemination channels for reaching and engaging with the different audiences. And then we're going to talk really briefly about involving your target audience. So what are the main things we hope you will take away from today's webinar? We hope that you're going to pick up some tips from us about how you can identify your target audience and just start to think about the questions that you would be asking yourself when you're thinking about, right, who's going to be my target audience for this Cochrane evidence that we're looking to disseminate. We hope we're going to give you some good practical ideas and examples of different approaches that you can take to producing dissemination products to target specific audiences and the channels that are available that are effective for reaching and engaging with those different types of audiences. And we also hope that through this webinar and the homework, we'll start to prepare you for involving your target audience in the production of dissemination products. If that's not something that you've already done before, just helping you build a bit of confidence to do that, because that's a really valuable part of producing dissemination products. So hopefully some of you will be familiar with the Cochrane main audiences. And the key to good knowledge dissemination is knowing who your evidence is for. And this is something that people talk about a lot. And I think when I first started doing dissemination, I thought, oh, they're always talking about who your target audience is. But it is really important. And so we wanted to spend a bit of time in this webinar really focusing on how you think about your target audience. And I guess these are the four main target audiences for Cochrane evidence. And they're the audiences, they're the people that will use that health evidence, that Cochrane evidence to inform their healthcare decisions. So we've got consumers and members of the public. So that can be people with lived experience, that can be carers, members of the public. We've got health practitioners. So that could be physios or nurses or doctors. We've got our policymakers and healthcare managers, and we've got researchers and research funders. So when you talk to Shauna about different audiences, she also then likes to think about our helpful messenger audiences as well. And so I think within the Cochrane strategy for KT, these audiences are sometimes referred to as intermediaries. And these are the really helpful messenger audiences like journalists, in fact, our sort of social media platforms and guideline developers that can help us access some of our main key audiences for Cochrane. So for me as a managing editor, it's actually horrifying, the thought of communicating with journalists. So it's great when Shauna delivers this slide, because that's something that she's brilliant at. And that's the great thing about the Cochrane collaboration. We have all sorts of people that work with us that are really confident in knowing how to work with and access different types of audiences that we're trying to target, and in particular journalists. And so actually, just in preparing these slides for this webinar with Shauna, I've sort of learned that I don't need to be quite as scared of journalists as maybe I was before. And so the thing we also would like to just sort of make a point at the beginning is to say, throughout this presentation, there's a lot of examples of work that maybe we've been involved in doing, and there's quite a lot of examples from the Australian media and UK media, and that might not be completely applicable, we know, to the jurisdictions that you're, or the countries that you're living in. So we have got some extra resources on the learning platform that sort of give examples of communicating in different, countries and different jurisdictions. So apologies in advance for lots of examples that are more familiar to us. So as well as knowing who your key audiences are, I think these 3 points are really important. And this is where Shauna would really want us to all pause and think about where we actually find these audiences. And I think it's more and more obvious now, when we, obviously in the pandemic, we're not on a train or we're not in a busy place. But when you see how fast people are sort of scrolling through information on their mobile phones, going and flicking through the newspaper on Twitter, then they might be on a website. And it's thinking about not just what the audience you're trying to reach, but where does that audience hang out? Where do your audiences hang out that you want to reach? And starting to think about those intermediaries of how you're going to reach your audience. So when we start thinking about our audiences, it's important to be starting to think about that as well. And then also asking ourselves, why should they actually care? So what is it that you want them, to take away from this? You're trying to capture these people's attention in these audiences, but they're bombarded by information all the time. So how do we make it appealing? How do we get that information in a format that's going to appeal to that audience? And also, when trying to decide who your audience is going to be, think about the kind of impact that you can make on your audience. So it's really important to really think, are you actually going to make the desired impact on that audience? So I might initially find a review and think, oh, the immediate audience for this must be parents. I'm going to think about how we might disseminate this information to parents. But actually, is it going to be the right kind of information to be targeting dissemination at parents? Actually, is that information more important to be disseminating to health practitioners? And actually, should we be targeting the dissemination to them? So I think it's really important to start not just thinking about which audience it is, but we'd encourage you to think about the types of information that you're planning to impart to that audience. And then through doing that, you start to think, well, actually, maybe it wasn't the audience that I thought it was that I'm trying to target. So it's about sitting down and asking yourself some hard questions about what you're actually setting out to do. And so these questions obviously can apply to Cochrane evidence, but they might also apply just to research in general. So are you actually wanting to spark a discussion? Are you trying to raise awareness about your new findings? Do you hope that these findings are actually going to implement a change in clinical practice? So these are the sorts of questions that you might start to think about. Are you trying to highlight a new approach to a particular issue? Do you want to change a behaviour or a belief? Or do you actually want to use your evidence to attract followers, supporters, people to partner with the organisation? So I think it's important to take a moment to ask yourself some more of these more abstract questions, if you like, because in doing that, it will help you sort of really hone in on which is the key audience for your particular review. Quite often with Cochrane reviews, as many people will know, there's not always some, there might be low quality evidence, there might not be a lot of studies, and so there's actually an evidence gap. So sometimes what we're actually trying to do is just raise awareness of this really important research area and actually highlight that there is a research gap. And so we might be trying to target a totally different audience when we're saying there's an evidence gap to when we've actually got something to say in our review where it might be a change in guidelines. So I think it is really important to think about that, and sometimes highlighting a gap in the evidence is actually also a really important thing to do. So it's time for a bit of interactivity because you've listened to me waffle on for a little while. So we wanted to know a little bit about you as an audience before we go on a bit further. So we've got 3 interactive polls, and we just want to go back to some of those key Cochrane audiences. And first of all, we'd like to know, which audiences do you or have you had experience at targeting before? So we've just got the list there, and that includes those 4 audience groups. So who people are used to trying to reach. So we've got researchers, research funders, policymakers, healthcare managers, health practitioners, consumers. We've thrown in journalists, one of our intermediaries. We've also thrown in students because that's a key interesting audience. There are health practitioners of the future potentially, and none. So looks like everybody might have already answered the question. We've still got a few answers coming in. Be interesting to see if we have a difference between the webinar yesterday and today. Oh, this is interesting. So it's looking like 43%, so nearly half of you have had experience in targeting your dissemination products at health practitioners. So that's great. And there's quite a few people with some experience of targeting things towards consumers. And we have got a few, we didn't have any at the last webinar who had too much experience with policymakers, but again, nobody's had much experience working with journalists. So it's going to be good at the Q&A to hear from Shaunette, and we've got a video later on that's going to help you feel confident with targeting dissemination products at journalists. Okay, I think we might be ready for the next poll. Okay, so poll 2 is just having a think, have you come on this course thinking about a particular audience that you are most interested in communicating with? Is there one of our key Cochrane audiences that you are sort of more intimidated by trying to communicate with? Most interested in. So we've got lots. I'm not supposed to talk about the results while they're coming in. So we've got the same list that you've been choosing from. Okay, so poll has ended and most people are interested in communicating with consumers. So people with lived experience, patients, carers, the public. So that's good. We've got people with experience of doing that on the course, but also people are really interested in working with, communicating with consumers. That's great. That's something definitely our review group is hugely interested in as well. Not so many of you are that interested in communicating with journalists. Let's see what happens in the next poll. Maybe that's because, like me, you're a bit scared of them. Okay, so yeah, the final poll is, which of these audiences are you most nervous and unsure about communicating with? We'll have to see if, like last time, it was the scary policymakers. Okay, lots of people coming through with their answers. Okay, I'm just going to apologise now because it's quite hard to multitask. So if people are asking questions in the chat box at the moment, I'm not very good at answering those at the same time as doing this. Okay, so yeah, most people are nervous, so 38% about communicating with journalists, and quite a large proportion there. We've got 29% policymakers and healthcare managers. So yeah, just to say, if Shauna was here, she would be saying that journalists are just normal human beings like we are, and they're actually very easy to communicate with. We just have to be brave. And also I should confess that a few years back I was a scary policymaker, and the people, when they're policymakers, maybe don't really know as much as people think they do either. So definitely, I think if we're targeting communication sometimes at consumers in particular, then the type of language and the style of the communication that we use can be very useful for some of our other groups and our intermediaries and also our policymakers as well. So that's great. So I think
I'll jump in for a second, Jess, as
brilliant.
Your second eyes who can't see the chat. Two main themes were emerging in the chat as we were going through. The first is that people work with more than one audience, and they only could select one. So it's interesting to know that for some of these questions, you may have more than one answer to that. So it's a good flag for us to know in the future about how these polls work. And the second theme that came up was that it's not necessarily that you're intimidated by a certain group, but you're just not sure how to do it yet. That's the second theme that's come up that a lot of people agree with.
Cool. It's just me that's mainly been very nervous of them then. Okay, so yeah, I mean, definitely, I think I would say that we don't always have the skill sets to know how to communicate with some of these audiences. Certainly in my job, I don't have those skills, but by working in partnership with people within Cochrane, that's where we can help and we can work together and we can learn how we can get our evidence to those intermediaries. And I think certainly working with people like Shauna and the central team who've got media experience, they're really good at helping do that translation piece and making those dissemination products really tailored towards particularly that media journalist type audience. Cool. So I think we're ready to go on to the next slide. So I'm just going to get rid of that poll. Oh, I found the chat box in the process of doing that, so that's good. Okay, so obviously this training course is all about the dissemination checklist. So how does what we've been talking about to start with fit with the dissemination checklist? And today we're covering item 1 on the checklist. And that is about deciding who your target audience is. And that's the most important thing at the start of planning your dissemination. Even if it's everybody, even if it's all of those groups, it's multiple of those groups, having a thought, thinking about that, thinking about some of the things we've talked about will guide your choices of language and content. And that is what the first item is about. But before you even start with the items on the dissemination checklist, on page 3 of the checklist, there is this really helpful kind of pre-checklist, if you like. And that's, again, just providing some really helpful questions to sort of run through in your mind when you're starting to think about who your target audience is going to be for disseminating a particular review. And in going through those questions, what really it's asking us to do is just to try and put on a pair of different shoes, to try and imagine that we're seeing it from the perspective of that audience. And so there's various different questions within that list that you can have a look at. I mean, some of them are quite obvious, but it's always helpful for us to have a look at them again. So what do you think people's familiarity is likely to be with the medical terminology? When we're producing Cochrane reviews, we get particularly used to different types of language. There's terms that I think are common terms, but they're not, because I've been working in mental health research for so many years that I just think, oh, everybody knows what that is. So it's good to be reminded that you need to really think about what everybody's familiarity is with that term. Certainly, sometimes even there's a difference between the language that, if we're thinking of English-speaking countries, there'd be different colloquial use of language that we need to be aware of. I found that quite a lot when I was working in New Zealand. There were certain words that I wasn't familiar with that were used in a different context there. I think one of the things that I find important on this list is thinking about people's access to the internet and thinking about where people are going to be accessing that information. And more people are definitely accessing information on their phone, on a tablet, on a device. They're not necessarily sitting at a PC on a computer. So some of these things need to be nice and easy to visualize and see on a phone, you know, in a much smaller screen. But again, it's going back to some of those questions from Shauna's slides at the beginning about the questions we need to be asking ourselves about what our audience actually is likely to be interested by. Okay, so another bit of practical work now, because I definitely always find that there's all this theory and I don't always have time to read and know all of the theory, and most of the stuff I learn through doing. So we're going to do a bit of a Mentipoll, and this information from the Mentipoll is going to help us in our work. So Shauna and I have been working on some dissemination planning for a Cochrane review that our group is going to publish hopefully next week on antidepressant medication for children and adolescents. And so we just like you to think about who the audience might be. So Dario, I'm just going to ask you to come in now and do the Mentipoll for me. Okay, so hopefully everybody is now able to see Dario's screen. And to take part in this Mentipoll, we just need you to go to www.menti.com. And when you get to that website, you're going to be asked to put in the code, and the code is there at the top of the screen, 21858301. And if you pop that in, then we'd just like you to think about who might be the target audiences that we're thinking about our dissemination products for this Cochrane review we've got coming out about antidepressant medication for children and adolescents. So you should be able to put in more than one audience in this one, because obviously there's multiple ones. But just pick the ones that just come into your mind first off. Don't have to think too hard about it. I can see people at the bottom of the screen are finding, oh, here we go. Yes, it's coming up. So that's always a bit worrying. It's starting to work. So yeah, so that's great. So we've got parents there, clinicians, parents and carers, obviously the children and young people, children, adolescents, got different phrases for those. They're really important. And that's a really interesting consumer group that we would like to try and get more involvement from. And we've been working quite hard in our group to try and find ways to involve children and young people in our research, in our reviews more. So that's great. We've got paediatricians, psychiatrists, guardians, mental health policymakers. So yeah, like us, there are we've been thinking of lots of different groups, and actually for this particular review, because the findings might actually have implications for guidelines and a change in guidelines. So we will be looking to sort of target guideline developers and policymakers to an extent, and we're trying to think very carefully about how we will communicate some of the findings from this review with parents and with young people, because it's obviously a big decision to be taken in partnership with health practitioners around the use of antidepressants in that age group in particular. So I was going to ask you, Dario, to screenshot the Menti again, if that's possible.
Yep, I can do that, no problem.
Brilliant. Yeah, that's great. So we screenshotted the Menti from last webinar and this webinar, and we're going to, Shauna and I are going to use that to help inform some of our discussions over the next couple of weeks. Okay, so just going to share my screen again. And so we're moving now on to part 2, which is dissemination channels for reaching and engaging different audiences. And this is where I'm going to pass over to the virtual version of Shauna. And she has kindly pre-recorded this section, so you don't just have to hear my voice for a whole hour. Okay, so Dario, I think I'm passing back to you.
So in this second part of the workshop, we wanted to look briefly at different dissemination channels and platforms that we commonly use. I've drawn together a few examples of work we've done here in Australia to target sometimes extremely broad audiences, other times very specific groups like clinicians or policymakers to do with a particular review. I thought that might be a good way to understand how these channels work in practice. So I'll share my whole screen because some of the images and text probably look better that way, and go from there. Okay, so I'll just start by doing a quick run through of the main dissemination channels we use here at Cochrane Australia. And I know many other people across Cochrane are keen on using these channels too. The first is Cochrane websites, newsletters, and social media feeds, which I always find a really good starting point for any dissemination of review findings. Next up, print and broadcast media. I know some of you may be daunted by the idea of reaching audiences this way, but I'll talk a bit more about that shortly. I'm a really big fan of using the media to reach different audiences and broad audiences, so we'll talk about that. Social media, which is a fantastic way to reach really targeted, specific audiences and interest groups. I'm not talking about that much today, as Stephanie, I know, has organised another workshop that focuses solely on social media, so I'll try to steer clear of that. But also YouTube and podcasting, which is increasingly popular. And I can talk a bit about that in the Q&A, as I've produced 3 series of the Recommended Dose podcast for Cochrane Australia, which was a really interesting experiment in reaching very broad audiences with sometimes very complex information. So that was often challenging, and I can talk about that if anyone's interested in that aspect of things. All right, this first example is a review on vitamin D for asthma. So the starting point for me thinking about disseminating these findings was, who are the findings of interest to, and who are they relevant to, and why do people really need to know about it? So some quick research revealed 1 in 10 or 3 million Australians suffer from asthma. And I know it's a big issue for children and their parents in particular. So for any review I work on dissemination-wise, I think about this kind of broader context. What's the conditional issue? How prevalent is it? What do people need to know about it? You're much more likely to get attention and engagement if you put the findings in a relevant local context, I find, in many cases. In this case, with parents and children in mind, I got in contact with Asthma Australia, who are the biggest not-for-profit peak organisation that works with GPs and schools to provide evidence-based information, workshops and advice. So they have over 2 million visitors to their website each month and publish a print magazine that's read by clinicians and policymakers and researchers as well. So after a few quick chats and emails to them, I just found a contact person on their website, gave them a call, sent them some emails, worked with the review authors to develop a content package, which Asthma Australia were really happy to publish online and in print. So this set up a great working relationship with them, and they went on to do the same for the next review on yoga for asthma. So you can see a couple of examples from them, the first 2 images and the Asthma Australia little square there with the balloon. That's their magazine and web content that they put up for us. So this is a great example of partnering with another organisation who already has the networks or connections to audiences that you are keen to target. To reach the broader public for this one, I worked with the authors to pitch the review findings to the Herald Sun, which is a tabloid newspaper here with a huge readership of around 1 million people a day. The Conversation, which is an online news platform, much more highbrow, loved by researchers and policymakers and academics. And finally, the Health Report, which is one of Australia's most popular radio programs and podcasts. So each of these different outlets appeals to and reaches different audiences within the umbrella of the public. So this is another quick example of targeting consumers and the public. Given I promise not to talk too much about social media, I won't say too much about it, but this review was on antidepressants. It came out just a couple of weeks ago, and I had the good fortune to work with Jess on this one. We created an infographic for this one for social media and a very targeted list of people and organisations to share it with. I also sent the infographic and an article to a popular public health blog site called Croaky. And again, I won't go too much into this side of things because it is social media, but suffice to say, it's a really huge part of reaching this sort of finely targeted interest and professional group audience. In this case, it was mental health, and Jess can talk about that more in the Q&A, no doubt, as she and the Mental Elf on Twitter make a great team. So back to vitamin D again here. We know practitioners are a key audience for clinical findings for many reviews. Here are some quick examples of targeting nurses and GPs through journals and professional society websites. And of course, the Cochrane blog shots are often used to provide a snapshot of the evidence, again, on social media. Policymakers can be a bit more of a tricky or elusive audience to reach, I've found, but I keep a close watch on what's going on in our state and national level governments here at any given time. My background is in public policy and government, so I know there are always many reviews and inquiries and reports being written at any given time in the health sphere. So in this example, a new Cochrane review on elder abuse coincided with a national inquiry into elder abuse. I put a brief one-page summary of the review findings together along with the review and submitted that to the inquiry. We then wrote a newsletter article about it and tweeted that out too. And this meant we were both making a practical contribution to policy debate within government and engaging in a broader public discussion that was going on about elder abuse in the media at that time. Okay, I'm conscious of time here, so I'll just quickly run through researchers and research funders, a few examples here. I like to profile researchers on our website, Cochrane Reviewers. I know that researchers like reading about each other and their work. In terms of funders, the example I have here is Julian Elliott's podcast that we did for the recommended dose. So he went on one episode and shortly after that was contacted by a top health official who had heard the episode and wanted his thoughts and input into a policy on health systems. So he was called into the department and shared his views there. So that was a great example of how the podcast was meeting research funder target audience. The last two are just a couple of visual abstracts that we developed in the last year or so to share with research funders and research organisations, a snapshot of findings from Cochrane Review. So I'm always really keen to find short, snappy, visually appealing ways to summarise the evidence and get them to all audience groups, because I think people are really receptive to something quick and snappy and good looking, because there's such a demand for, people's attention. It's hard to get it. This is a good way to do so. Okay, so that's a lot of examples, platforms you can use, but what's the secret to engaging audiences on those platforms and getting your work to people through some of these media channels I've highlighted? I asked Australia's resident award-winning national science reporter to share his tips with us, not just to give you a break from me presenting at this stage, but because he literally writes about science and health for hundreds of thousands of people each day, hugely different audiences reading his work. So here are his top 5 tips for Cochrane contributors.
Okay, so we're going to hear a really great video now that Shauna has recorded with Liam. So Dario is just popping that on for us. So, and there's a full version of this video also in the resources that you can listen to as well. So I will be quiet again.
In science papers that are typically published, I see you guys do this, you'll sort of go all the way through and then you put the most important thing, the conclusion, right at the end. In journalism, we think that that is the wrong approach. We think you should have it exactly the other way round, because we know, both from our own experience and also from cognitive science, that the information that people take in is the information that's right at the top, the thing at the very start. So I would almost encourage you, when thinking about Cochrane, to say, what is the number one thing to communicate here, which would typically be the outcome of your report, and I'd put that right at the start. In journalism, there's a trick that you could borrow if you like. We say that you cannot write a story unless you can tell your editor what it means in one sentence. We know that human beings, human minds, relate to stories and parables much better than they do sort of free-form information. If you can find a way of turning your information into a story or a narrative, then that's a much more powerful communication. So rather than just, we found X, the story is really, you know, here's a bunch of people doing all these different things. It leads to this confusing and perhaps not evidence-based practice. We wanted to get involved to try and answer that question. Here's what we found, and here's what it's really going to mean, or what it should mean for practice, and what it should mean for the individual. Particularly when you're working in it, you can become very obscured by how we came to our findings, or the methodology, or the technical nature of the process that's being described. But that's really not what people need to know. What they really want to know is, what does this mean? How do you arrive at the answer to what does this mean? I find often the best way to do it is just to sit down with somebody and talk to them about it. And say to you can almost say to them, you know, a non-technical, non-scientific person, I want you to tell me what you think this means. And then you just go back and forth with them, explain to them the evidence. And, you know, most people, if you can explain it to them, right, will eventually be able to go, oh, so what this really means is X. I would encourage scientists to pitch journalists and then work with them to make sure that they help them in any way they can to get the story right. So whether that's saying to them, look, you know, I'm here on the phone all day. If you want to send me a text just to clarify facts, or if you want to send me an email just to get it right, you know, if that you don't hear from them, you know, you could even come back to them later in the day and just say, hey, look, just checking. Do you want to do any fact checking with me? I'm around. And then when the story does go up, feel very free, if there is a glaring error in there, to send them a nice email, because then, again, they're not trying to get your story wrong, and say, hey, look, you know, I saw this bit's not quite right. Let me help you. People really are hungry to understand science, are hungry to think it through, if you can explain it to them in simple, jargon-free terms. We're not talking about dumbing down, we're talking about clarifying and getting purity of message. So if the message is simply, we don't know if this works, there's no evidence that it does, people can get that. People can understand what that means. And so I suppose I would encourage the people at Cochrane to think, to be bold. People do want scientific evidence to inform their lives if you can explain it in a clear, pure manner that they can understand.
So that was really great to be able to hear from Liam. He's a really big deal in Australia. So it was great that Shauna was able to get him to spend some time talking to us about that. And he's a great fan of Cochrane evidence. So that's cool for us. Okay, so I'm just going to share my screen again. So hopefully everybody can see that. So we're through to the third part of our presentation. And this is where we're going to really just touch on involving your target audience in the production of dissemination products. So we've talked a lot about wearing other people's shoes and trying to think about what your audience wants to know about, and you know, what skills, you know, in language your audience has, what medical terminology they understand, etc., etc. But let's face it, as much as I love that gorgeous pair of high heels, there's absolutely no way that I'd be able to walk in them at all, especially not after a year in lockdown. And I am much more comfortable in my own sort of trainers or slippers underneath my desk. So we can't really always know what is going to be perceived, how people are going to receive that information. And it's human nature. We make a lot of assumptions about what we think people will want to know about. But in reality, the best way to find out what people need to know and what our audience wants to know and how to present that information in the best way to our audience is to involve them in the production of those dissemination products. And in our group, we've been lucky enough to work with one of the Cochrane consumers, Karen Morley, who volunteers with Cochrane more broadly. And she did this brilliant illustration that just sort of shows that kind of level of confusion and what might be going through, certainly was going through her mind at a point when she was involved in some work with us as a consumer, and kind of all of, you can see the swirling technical medical jargon around her head. So we just really wanted to think about this item in the checklist, just touch on it, because really item 1 is about, have you involved your target audience or sought their feedback in the production of that dissemination product? And there could be a whole series of webinars, and that's something, you know, there's lots of information out there about the best practice for co-production and how you do really good co-production of dissemination products, and even co-production of research and co-production of priority setting, etc., with your different target audiences, and in particular with consumers. And we're not going to have time to cover all of that and do it justice today, but it's a really important part of the checklist. And I think it is also a really time-consuming part of what we are talking about. And I think we really can't underestimate how much extra time actually just putting in one small cycle of user feedback into the process of producing a dissemination product, how much time that actually takes. So I think I don't want to put people off when we're talking about this particular item in the dissemination checklist, because I think it is something that you can grow in confidence doing, and you can start to gradually bring into what you do. And if you're lucky enough to start to form some good working relationships with different audience groups, whether it's health practitioners, maybe some of your authors are also a health practitioner, and you can sort of bounce ideas off them because you've already got a good working relationship with them. So it's just about really highlighting that is a really, really important thing. And you can find out a lot of useful information and really improve your dissemination products from doing that in partnership with people. And so we've been lucky, we've had some consumer input to some of our dissemination products. And so to be a little bit aspirational, we wanted to show you an example of a video to disseminate some review findings that we did, and this was done in partnership between one of our authors and Karen, who drew that illustration, who's got lived experience that's relevant to our group. So I'm just going to play that video, if that's all right, Dario. And I'll check out the chat while it's playing.
Behavioural activation is a type of psychological therapy. This Cochrane systematic review asks whether behavioural activation can help to treat depression in adults. The authors searched for studies called randomised clinical trials. They found 53 studies conducted from 1977 to 2019, with 5,495 participants across 14 different countries. When all the results were pooled, the authors found behavioural activation may work better for depression than the usual treatments, such as counselling, providing information on depression treatments, or a GP monitoring someone's symptoms. Behavioural activation seemed to work as well as some other psychological therapies that are often used to treat depression, such as cognitive behavioural therapy, or CBT. These findings indicate that behavioural activation may work to treat depression in the short term, adding to the choice of available treatments. Our confidence in the results is limited because there were issues with the quality of the evidence. For example, few data being available, or estimates of effects not being very precise, meaning the true effects may be different from what we found in these studies. In practice, the evidence from this review may not apply equally well to everybody. Most of the evidence was from high-income countries, and most studies were only conducted for up to 6 months, meaning we don't know much about the effects of behavioural activation in the longer term. Find out more by reading the full review on the Cochrane Library.
Great, so that's just an example of a dissemination product that was co-produced. There's some really interesting questions coming up in the chat, and so I just wanted to say we will definitely discuss some of these. I think probably more likely we'll have to pick some of them up in the Ask the Trainer session, which is that half-hour session, and maybe some through the LXP we can answer them. I was particularly interested in the question about consumers knowing what a systematic review even is, and that's something that an issue we've had in the past, and we've got some ideas of how you sort of mitigate for that and how you can still involve people and they don't actually need to know so much detail about what a systematic review is to get them involved. So for the last little bit of the session, we just wanted to do a bit of looking ahead. So I'm just going to share my screen again. So it's not always as easy to get all of this sort of feedback through kind of face-to-face discussion. And as much as it's great to have face-to-face discussion, we can actually learn quite a lot about how our audience is responding to some of our dissemination products through analytics. And I have to admit, these are some slides that Shauna has put together, and having time to really start to delve into analytics is something that is a bit aspirational for me at the moment as a managing editor, but I have started to try dabble a little bit. So I just wanted to highlight some of the things that you can do to actually get quite a bit of information about how you're presenting your dissemination product, how well it's going down. So there's lots of analytics available that sit behind the Cochrane websites that we've all got. And so Shauna uses that a lot with the Cochrane Australia website to be able to see which news articles are getting picked up and getting the most views and how much time people are spending. So if she's got a news article on there, people are clicking on it, but they're not spending very long and they're not obviously reading the whole article, that can tell you a bit about whether the information's targeted correctly. There's some really good Google Analytics courses as well that certainly Shauna would recommend. And there's free courses that people can take if they are really interested in analytics, is something they really want to look at. And I think Twitter analytics are something that I've certainly found are a little bit more accessible. So Shauna was having a quick look at some of how much impact some of the tweets that she had put out that involved the infographics that we produced for the recent discontinuation of antidepressants review, and she's done a bit of sort of experimenting really, and does find that you get a much better engagement if you're tweeting out images and infographics with your information. I think just really quick tips that I've found from a review group perspective is we don't have a massive number of followers on some of our social media accounts, and particularly Twitter. So I tend to get the best engagement when I tailor the tweet to get a retweet from a bigger organization, whether that's a mental health charity or partner organization, or whether it's just Cochrane central accounts. So I think sometimes it's not just about images, it's about how you write your tweets and how you tag different people to get that retweet, and that can help your impact. But certainly I've found that through tinkering a bit with analytics, I've been able to start learning how to do better tweets. Some people might choose to disseminate through newsletters, and again, that's something where Shauna finds analytics are really useful on a newsletter. She has this media watch section, and that enables her to see which articles are getting read and clicked on. And she was surprised to find out that people were really interested in the annual scale and polish. I was less surprised because I'm a bit obsessed with teeth. But yeah, so the analytics are really helpful to sort of show you what your readership is wanting to see or what your audience is wanting more of. We've been dabbling a bit with YouTube as well recently, and the analytics for YouTube are kind of mind-blowing, the amount of information you can get from those. So they are quick ways of seeing if your audience is liking what you're showing them. And I think we just really wanted to leave that with you, that thought about actually how do we start to think about using analytics a bit more as an organisation. So I'm going to pass back to Stephanie now because I've spoken for too long, and leave you to wrap up in less time than I should have.
That is totally okay, Jess. I'm going to go through this quick because there's a couple questions on the chat I think we could squish in before the end of this presentation. So thank you, Jess. Virtual thanks to Shauna. I'm sure there are many other questions other than the ones we've seen in the chat today. So very quickly, the webinar is recorded. We will post it on the Learning Experience platform. And if there are any questions you didn't ask today, please post them in the comments section next to this video and we will address them there. If not, we will address them at the Ask the Trainer session 2 weeks from now. Next slide, please, Jess. And then in terms of what happens next, so for the rest of this week and next week, we invite you to head back over to the Learning Experiences platform. There are some activities that will help you apply what you've learned today in practice. You can see the activities listed on the screen here. This is a screenshot from the platform, and it should take you under an hour to do all of the recommended activities. And for those of you who are a bit more keen, we have some additional activities should you wish to embark on them. We also have additional resources if you'd like to know more about this topic. And while nothing is required in this course, it's up to you how much learning you want to do at any given time. We strongly encourage you to do the activities to get the most out of the learning. Next slide, Jess. And in 2 weeks from now, we have the Ask the Trainer session. So what that will look like, we'll have an icebreaker, some more interactive polls, but we'll mostly focus on any of the questions you have on this topic that weren't addressed today or online. We will be answering them then. So I'll flip back to Jess now to see if she can answer some of the questions that were about the video, and we can say our final goodbye.
Cool. So I can see that there's interest in cost for the video. Getting a video like that done takes quite a lot of time and a bit of back and forth, but you're looking at maybe £3,000 UK to work with an animation company. So that's probably like our kind of high level. And sometimes if you've got a program of delivery of systematic reviews, maybe funded as part of a program grant or something, you can put in that extra cost for dissemination. And we know other groups who've done that, not just for Cochrane reviews, but for other research. Having said that, we tried to do a real budget version, and we can tell you a bit more about that in the Q&A session, where I did it on the back of a, kind of on a shoestring budget with much less time, and we still think we got an okay product. But Shauna's got a lot of good ideas about actually should we bother if we're not going to do it properly, and yeah, so it's a very interesting discussion, like how much resource we've got. With that particular video, I tried to hand it over to the author to do that, because as managing editor, I was like, we need to stop. We haven't got the capacity to do it, so let's try and empower the author to do it. But it did involve money. Sorry, that was a bit of a long-winded answer to that question. But yeah, it'd be great to pick up some more of that in the Q&A session.
Great. Thanks, Jess. And thanks, everyone. Hope you enjoy the rest of your evening, day, morning. And we look forward to seeing you at the Ask the Trainer session in 2 weeks. If not, we'll see you online on the Learning Experiences platform. But thanks, everyone, and we'll see you soon.